Hello, I'm Grant Headley, physical therapist, here with Dr. Jeffrey Tucker at his office in Los Angeles. And we're using the piezo wave to treat the sacrum. And the piezo wave is a focused shockwave device, and we're using it to act on the body with three mechanisms. One is to break up scar tissue, two is to increase blood flow, and three is to reduce inflammation to the tissue. So on the sacrum itself and on the sacroiliac joint, we are going to go a little deeper, and how we use the piezo wave is we can vary the depth of penetration of the energy of the shock waves. And so we apply some ultrasound gel to this linear applicator, and then we're going to use this device that brings the focus of the energy 3 centimeters into the body. Now, before doing this treatment, what we do is we find a motion that is restricted on the patient. We test it beforehand, and we test it after, and that way we like to apply a tissue tightness or a tissue that it has some scar tissue could be restricting a person's motion. So during an evaluation, I use the piezo wave to scan the body at a fairly low frequency, around a 4, and we're going to start with a fairly low intensity level so that the patient can feel where we're going to be treating. And if we're over a tissue that has normal characteristics, the patient will not feel any discomfort whatsoever. So if we start right around on the right PSIS area, where we have a lot of important pelvic ligaments attaching, we start the treatment. Now, Dr. Tucker, do you feel anything here at this level?
Not yet.
Okay, so
I hear the clicks.
We're hearing the clicks. We're not feeling anything, and so either that tissue is normal, or we need to find a different depth, or we're going to increase the intensity and slowly scan the area as we slowly increase the intensity of the treatment. So far,
just beginning.
So we're just beginning
feel.
at an intensity level of 13. What do you feel, Dr. Tucker?
It's actually a pleasant sensation where each click is synchronized with a pulse sensation, and I can feel you slowly gliding or scanning the area. And there are certain points, even if you move just a millimeter or two almost, it seems like there's different sensations. Some feel like nothing, and then I know if you were to go a little bit higher, it feels like I'm going to feel something that might be a little bit of a dull ache.
And that's one of the remarkable features of the piezo wave, is that it's very specific. We move a very slight amount, and the patient might not feel anything at all.
Yep. There I don't feel anything.
And then we come a little bit more medially, and you might feel a little
Definitely.
more. Okay. And then so at this depth, let's say Dr. Tucker's tissues here are not very dysfunctional, so we're up at the upper range at this depth, and so he's able to tolerate this without very much discomfort at all. Now, patients with chronic pelvic pain or prostatitis oftentimes have quite a bit of, say, discomfort here, and we are working down in the single digits of intensity at this depth. And so, let's say that we were to do a full treatment here. We would focus on one area for at least 500 pulses on the first treatment, maybe upwards of about 1,000, and some practitioners even go upwards of 3,000 to 4,000. But let's say that we're going to be conservative today, if this were our first treatment, and we get to use the piezo wave to evaluate the tissue. We keep track of the depth of penetration, the frequency of treatment, the intensity of treatment, and how many pulses we use, so that we can track how the tissue is progressing through the treatment protocol. If a normal treatment protocol is, let's say, 8 to 10 sessions, we're going to watch the tissue start to recover and improve in its blood flow and improve in its mobility. And the patient can usually, as the tissue is becoming healthier, we can tolerate a higher amount of treatment on the area with less discomfort.
You have it at a nice comfort, and when you go over certain spots, Grant, I can actually feel a little twitch response internally, which is good. You know, the deeper muscles, right about there.
Closer
is
to
an
the
example.
coccyx, yeah?
Mm-hmm.
Okay. So then we could be treating something around some of the sacral nerves. We might be tagging a little bit of the pudendal nerve as well, and perhaps some of those pelvic floor levator ani muscles. And so as we're closing in on about 1,000 pulses on this right side, we would also like to address the tissues on the left side and repeat that treatment there. And let's say a typical pelvic floor treatment consists of the sacrum, the coccyx area. We would also address the entire tract of the pudendal nerve running around the ischial tuberosities. And then for patients that have primary erectile dysfunction as their issue, we also address directly on the erectile tissue itself. And for those tissues, we would use a much shallower depth, something like this 5 millimeter attachment, which concentrates the energy very close to the surface, about 5 millimeters from the surface. So in closing, let's say this piezo wave device has drastically improved my results as a physical therapist to be able to help men quickly turn around their chronic pelvic pain that they have been suffering from for months to years, and within about 6 to 8 weeks make some noticeable improvement and get them on a path to long-term healing and full pelvic function and enjoying their life, and that improves relationships as well. So thank you very much.